Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of obstetrics is the neonate. We will cover our topic of neonate in 5 sections. In the first section, we will talk mainly about the anatomy and physiology after the birth or in the neonatal period. And also we will talk about some metabolic physiology, how the metabolism or different metabolic reactions takes place in the neonatal period. Also, we will talk about principles of neonatal care and the management and poor condition at birth. Then in the second section, we will talk about some neonatal abnormalities, which we will discuss breathing difficulties or breathing abnormalities. Then also different infections, and commonly we will talk about bacterial and viral infections and also congenital abnormalities. In the third section, we will talk about encephalopathy and other problems. And encephalopathy is the abnormality or pathology of the brain. Cephalo is for the brain, so encephalopathy. Then we will talk about some other problems and then neonatal screening and immunization. So that will be covered in the third section. Then in the fourth section of our lecture, we will talk about the preterm babies, how we can do the antenatal management in the preterm babies, what's the initial care of viable premature baby. Viable means a live baby. And then how we can manage breathing, circulation, nutrition, and infections in the preterm babies. And then in the fifth and final section, we will talk about antenatal and palliative care, what's the antenatal counseling, breastfeeding and medications which can be used easily and safely during that period of breastfeeding. And then we will talk about the palliative care. So all this will be covered in our today's lecture, Neonate. So to learn about this topic, keep watching sqadia.com.